In Module 3, we will review best practices for safe insulin injections. The topics reviewed in this module include the prevalence of needlestick injury, also known as NSI, risks associated with needlestick injury, clinical recommendations to reduce needlestick injury, and the proper disposal of sharps. Let's turn to our first topic, prevalence of needlestick injury. According to EpiNet data, insulin needles account for the largest percentage of injuries from all needles on syringes, at approximately 20%. Nurses sustain the most needlestick injuries of any healthcare provider type. One study reports that in nurses caring for diabetes patients, the cumulative annual incidence of needlestick events was 448 needlestick injuries per 1,000 nurses. The CDC estimates that 62 to 88% of sharp injuries can be prevented simply by using safer medical devices. There are several opportunities for needlestick injuries in diabetes management, including lancets used in checking a patient's blood glucose, insulin pen needles, and insulin syringes. Let's take a look at the risks associated with needlestick injuries. Accidental needlestick injuries can lead to serious bloodborne pathogen infections. More than 20 bloodborne diseases can be transmitted as a result of exposure to blood. The emotional impact of a needlestick injury can be severe, even when a serious infection is not transmitted. The prevalence of hepatitis B and C has been shown to be higher in patients with diabetes than in the general population. The CDC estimates that baby boomers, born between the years of 1945 and 1965, are more than 5 times likely to have hepatitis C virus than any other age group. This is important for caretakers, given that persons 65 years of age and older represent approximately 63% of the population that is in need of long-term care. There are still risks associated with HIV in long-term care patients. In 2014, an estimated 45% of Americans living with diagnosed HIV were aged 50 and older, while 27% were aged 55 and older. With the prevalence and risks associated with needlestick injuries, it is critical that we look to reduce the occurrence of these preventable injuries. The Occupational Safety and Health Administration, also known as OSHA, has numerous standards to protect workers, one of which is the Bloodborne Pathogen Standard. This standard was designed to protect workers from the risk of exposure to bloodborne pathogens, including HIV, hepatitis B, and hepatitis C. As part of this standard, each employer having employees with occupational exposure needs to establish a plan designed to eliminate or minimize employee exposure. This plan will be reviewed and updated at least annually, reflect changes in technology that eliminate or reduce exposure to bloodborne pathogens, document annual consideration and implementation of appropriate commercially available and effective safer medical devices. Solicit input from frontline staff, such as nurses, responsible for direct patient care who are potentially exposed to injuries from contaminated sharps. Some of the costs associated with sharp injuries include the following: loss of employee time, cost of tying up staff to investigate the injury, expense of laboratory testing, the cost of treatment for the infected staff, and the cost of replacing those staff. In the next section, we will review the recent clinical recommendations published in the Mayo Clinic proceedings to reduce needlestick injuries. Nurses and healthcare providers must receive appropriate education and training on how to minimize risk. This includes following optimal injection technique, making sure they are using safety devices to reduce their exposure risks, and wearing appropriate protective clothing, such as gloves. When administering insulin, a healthcare worker needs to make sure that they are protecting both the patient and themselves. This includes safely delivering the medication to the patient, as well as making sure they activate the safety feature of the device and dispose of the used injection device into a sharps container. When it comes to insulin delivery, there are specific recommendations that you can implement to help optimize healthcare worker safety. First, make sure that safety injection devices are used if injections are given by a third party. This should include frontline, non-managerial staff assisting in the identification, evaluation, and selection of both disposable insulin syringes and pen needles to ensure that safety devices are utilized. Secondly, Devices should have protective mechanisms on all ends of the delivery device. This is particularly important if you are using insulin pen needles, as there are two sharp ends. Dual-ended, safety-engineered pen needles shield both ends of the pen needle after use. Finally, one of the ways that needlestick injuries can occur is when a healthcare provider uses a skin pinch-up technique to give a subcutaneous injection. This is called a skin fold. To minimize the risk when an injection is given by a third party, the use of 4 and 5 mm pen needles or 6 mm insulin syringes without a skin fold is recommended. This is important as safety mechanisms will not protect against needlestick injuries through a skin fold pinch-up method. There are two types of safety-engineered devices for insulin delivery that will be reviewed in this section: active and passive. Active devices require the healthcare worker to take action in order to activate the safety mechanism and protect the exposed sharp end. All safety-engineered syringes are active safety. This requires a manual process by which the healthcare worker has to activate the device. Single-handed activation only requires one hand to activate the safety mechanism. This is preferred as the fingers stay behind the needle and the other hand can partake in patient care activities. Two-handed activation devices require both hands to be on the device at one time, one hand holding the device while the other hand is activating the safety mechanism. With two-handed activation, there is more risk of needlestick injury occurring as the hand activating the safety mechanism has to move alongside the needle. For passive safety mechanisms, the safety feature is automatically activated post-use, which can aid in helping to reduce needlestick injuries. With insulin delivery, all safety-engineered pen needles are passive. However, there are two types of safety pen needles: dual-ended safety products and single-ended safety products. The difference between the two is that with dual-ended products, there is a passive safety mechanism on both the front end and back end of the needle, whereas a single-ended safety pen needle only has the safety feature on the front end. According to the insulin delivery recommendations published in the Mayo Clinic Proceedings, protecting both ends of a sharp is recommended to reduce the risk of a needlestick injury or occupational exposure. Needlestick injuries can also occur during disposal of the used sharp device as well. Understanding how to safely dispose of sharps is critical in preventing needlestick injuries. As many as 1/3 of all sharps injuries occur during disposal, and nearly 25% of sharps injuries occur to staff that are not involved with the actual injection. Therefore, recommendations for safe disposal of sharps state that safety mechanisms should be activated before disposal, and all insulin devices should be immediately placed in a sharps disposal container after use. In summary, there are several opportunities for needlestick injuries in diabetes management, including lancets, insulin pen needles, and insulin syringes. The OSHA Bloodborne Pathogen Standard was designed to protect workers from the risk of exposure to bloodborne pathogens, including HIV, hepatitis B virus, and hepatitis C virus. Safety-engineered injection devices should be considered first-line choice if injections are given by a third party. Devices should have protective mechanisms for all sharp ends of the device. Dual-ended, safety-engineered pen needles shield both sides of the pen needle to help reduce the risk of needlestick injury. Now, let's work through a self-check quiz together to reinforce some of the key learnings from this module. The OSHA Bloodborne Pathogen Standard was designed to protect workers from which of the following bloodborne pathogens? A. HIV, B. Hepatitis B virus, C. Hepatitis C, or D. All of the above? Correct. The answer is D. All of the above. Question 2. Which healthcare worker sustains the most needlestick injuries? A. Physician, B. Nurse, C. Dentist, or D. Pharmacist? Great job. The answer is B. Nurses, who indeed do sustain the most needlestick injuries compared to other healthcare providers. Question 3. True or false? A dual-ended safety-engineered pen needle shields both the front and back end of the pen needle to reduce the risk of needlestick injuries. True. Dual-ended safety shields both ends of the pen needle, including both the front and back end. Final question, number 4. How does an active safety mechanism on insulin syringes work? A. It automatically conceals the needle post-injection, which can aid in reducing the risk of needle stick injuries. Or B, it requires the healthcare worker to take action in order to activate the safety mechanism and protect the exposed sharp end. Great job! The correct answer is B. This concludes Module 3.